What really is damaged with a deadlifting injury? I'm not talking about just a sore old back from deadlifting. I'm talking about a serious injury from deadlifting that puts people out of training for a few weeks or even a few months. My name is Musson. I'm an interventional pain physician. The deadlift movement is complex, and we're not going to talk about all the specific biomechanics. Basically, there's a compression force and a tension force put on the spine through this activity. There's a lot of good information online about deadlifting, making sure your biomechanics and your posture or your form is good while you're doing the deadlift. I'm more going to focus on what happens when the deadlift activity damages the back or the force exceeds what some of the tissue can handle. One problem with these injuries is they don't often show up on MRI. So you have this back injury from deadlifting, you go get an MRI, looks normal. So what does that mean? One potential problem we can see with this type of injury is a muscular attachment. Like for example, the thoracolumbar fascia attaches onto the iliac crest. But what I see more commonly is damage to some of the supporting ligaments of the lower lumbar spine. Those are the iliolumbar and the sacroiliac ligaments. And these can fail right where the ligament attaches to the bone. That's the weakest part of the ligament. Often when these are injured, they're not very vascular, so they don't heal very well. Sometimes if these ligaments are damaged enough, it allows for some laxity in the lower portion of the lumbar spine, which then allows for additional stress to be placed on the intervertebral discs, which then can tear or can even herniate out. And these changes can be seen on MRI. If I have an athlete come in that's had a recent back injury related to deadlift, the first thing that I typically do is pinpoint the diagnosis by anesthetizing the specific structure that I'm concerned about. And if their pain improves significantly as I numb up that specific ligament attachment, then I can say, hey, this is the problem spot. This is what we need to do to get you feeling better. Sometimes if these injuries are left untreated, people can go through their lives what they call a bad back that will flare up with very minimal irritation. And that's due to the poor vascularity of these structures, and the body has just a hard time healing those spots. Make sure to subscribe, and until next time.